Welcome back to Community Connected Health. I'm your host, Skip Lowe, and my co-host,
Colton Storla.
So happy to have everybody that's willing to listen and see what we have to say today. I'm very honored to introduce our guest today, featured speaker today and guest, I should say, moreover, is Dave Chase, co-founder of Health Rosetta. For those folks that don't know about Health Rosetta, we're going to give you quite the education today. I've been working with Dave for the last several years, and he's been instrumental in my career and the pathway that I'm leading to the bitter end here, so to speak. And so really excited to get into the discussion here today. Before we get started, Dave, I'm going to ask you a tough question here that maybe not so tough. All of us in this business, can I say this business, in the healthcare consulting world and trying to reimagine healthcare, we had a seminal moment in our life. And I'm just wondering, was there a point in time in your career, obviously that had to be where you're like, I'm fed up. I just have had enough of this business and I just need to find out where all this money's going, or see why people are dealing with so much high costs and dealing with their healthcare needs, et cetera?
Yeah, unfortunately, my story isn't that unique, but it was for me. And it was seeing a friend get destroyed by the system, physically, financially, emotionally. Got the wrong cancer diagnosis. That happens at least 1 out of 5 times. It's not that unusual when you don't get people in the right program. And of course, that's going to lead to the wrong treatment plan. And, at the end of the day, destroyed her, leaving behind a 10-year-old daughter who's a single mom. And that really, more than anything else, put me on this quest to unpack why did that happen. And it wasn't a single bad doctor or bad hospital. It was a system issue. And so that really, I'm one who tries to find meaning and something positive out of tragedies. And that's why I switched from being, really a health tech guy to a health plan guy. Because as I figured out, there's no accidents in our healthcare system. Everything that happens, for good or bad, is facilitated by all this morass of legal documents we call a health plan. Mm. And so that's why I went on this quest, and it was like learning a whole new industry, a decade plus ago. And it is the biggest lever, not only in healthcare, but I think in our entire society. So I, believe in the old adage, the 2 most important days of your life, the day you're born and the day you figure out why. Figured out my why. And so this is what I was called to do. And, God willing, I'll be doing a long time.
So you obviously had a civilian life before doing what you're doing. And thank you again for the crusade that you're leading across this country. It's quite amazing. But tell us just a little bit about your background. And you're obviously on the tech side, but just for our listening audience, just a little teeny bit background to you. And we know what your moment was when you just went into this crusade, but that would be just helpful as well.
Yeah, sure. I started my career in management consulting, working for Accenture. And I was working mostly inside of hospital finance departments and billing departments. These days, there's this fancy term called revenue cycle management. That is what that work is termed as. And then I left. There was this emerging company called Microsoft that was in my backyard, and I was in their adolescence. And the short version of that story is I started their healthcare partner ecosystem. So if you fast forward to today, and I don't take credit for all this, but it's become the most successful tech ecosystem. There's like 28,000 different partners on the Microsoft platform. It's about a $30 billion ecosystem. So you think about all that electronic health record software and, stuff that, is involved in drug discovery in doctors' offices. It's got to be built on something. And so I got that started. And so that was quite a ride, an amazing experience. Got to work with Bill Gates quite a bit. And then this thing called the internet came along. Thought that might become a thing. And actually left the healthcare role for quite a while. And was involved initially at Microsoft and then outside of Microsoft. I've been out of Microsoft over 20 years now. Um, and then it was my friend's situation that I shared that really pulled me back into healthcare, and then put me on this journey. And so there's a few other twists and turns, but that's kind of the big arc of my professional career.
Wow, incredible. Today we're going to be today's conversation. We're going to really be focusing on helping out CEOs, CFOs, and HR leaders who feel like healthcare is broken. I think you're the one that said healthcare isn't broken. It's working exactly the way the insurance companies want it to. Quote you on that, but it's one I use quite a bit. But want to know actually what can be done about it. So, Colton, I'll let you go ahead and fire away here.
Yeah, maybe before we jump into some of the tangible things that our audience could take from this, maybe shed some background on, or shed some light on the background of like Health Rosetta, how that got started, current state and future state, for maybe some CEOs, CFOs, and HR leaders that aren't familiar with Health Rosetta at this point.
Yeah, I mean, picking up kind of where I left off, realizing that it was health plans that were at the root of our issues. I didn't realize the magnitude of this problem is about as big as it gets, right? This is like, women's suffrage or civil rights. I mean, it's these massive scale problems that if you're going to solve, you need to have a broad movement. It's essentially kind of a social movement and a business thing where the analogy that I kind of arrived at most frequently was the built environment. There's this thing called LEED standards that spec out how to build buildings, and the way, and I like the analogy there because the built environment's kind of like healthcare. It's this really deeply local, deeply entrenched thing, and yet the way buildings are built and maintained today is radically different than 25 years ago. And so there was this blueprint. Hey, here's how to build buildings. They're more efficient with energy. The air is better, all those kinds of things. And then they trained folks like architects to design these buildings. And then they certified buildings. Hey, this is LEED bronze, this is LEED gold, and really reset the expectation of what an outstanding building was. And so there's quite a few parallels here. And that's what we did with Health Rosetta is we came up with this blueprint that was an aggregation of, as I studied across the country, a little bit around the world, what actually worked best. And, the Rosetta name came in going back to those health plans. Like, what's a health plan? It's a bunch of legal documents. Those legal documents are the Egyptian, the equivalent of Egyptian hieroglyphics. And these organizations had cracked that code. So the idea was, okay, what they've done is incredible. Rosen Hotel has been doing it 30 years, best health plan in America. They've great for the business too. They've saved $570 million. They've created this plan that is led them to have 6 times better employee retention than their competitors. And so our thought was, when we founded this, I did a TED Talk. It was actually in 2016. I wrote a book that published 2017 called The CEO's Guide to Restoring the American Dream. The subtitle was How to Deliver World-Class Healthcare to Your Employees at Half the Cost. And so it was something that had happened. The question is, could we replicate it? And so we went about doing that. And we found some of the early folks who pioneered this and kind of created this template. And there's and the theory was, okay, if we can succeed thousands of times replicating this, then by training folks, and then they bring it out to employers, both public and private sector, large companies, small companies, medium-sized companies, rural, urban, union, non-union, like pretty much every sector. If we could prove that thousands of times, and have it sustain over multiple years, it would be pretty hard to say we got lucky.
Yeah.
And at that point, what we would do is open source our methods. And so Health Rosetta itself is what's called a public benefit corporation. It's a special type of C corporation, which is a common type of corporation that has a public good purpose or social mission, whatever you want to call it. And then we have this nonprofit that we help catalyze, but is fully independent now, called Nautilus Health Institute. And so we gifted direct investment of about $4 million of know-how, like legal expertise, rewritten RFPs and contract templates, and then all this technology, with the goal of an entirely new industry supply chain has to emerge, right? It's kind of this, sounds really crazy big, and maybe it is, but it's also an obvious point. We didn't get iPhones by tweaking landlines and rotary phones. There was a new model, as Buckminster Fuller says, you never change things by fighting the current reality. You create a new model that makes the old obsolete. And like what happened with the built environment, the new rose over time, the old waned over time. And so we now have established Nautilus as this new set of industry standards and norms that are getting adopted by both the employer side, the real payers of healthcare, as well as some cases union, like Taft-Hartley plans, and the supply side, right? The PBMs, the TPAs, all that supply side in the healthcare providers. And it is this two-sided market. So that's really, what Health Rosetta is. It proves those things out. So we have worked directly in the trenches with advisors on 450 different employers. And so all these ideas are battle tested and now available for free to anybody. Now, it's still hard work to go implement those. You both know how even when you have a good blueprint, it's really tough work. And we never have claimed that we have an unbroken string of successes. Like anything great in life, you want to be a great, spouse, parent, athlete, musician. It's really hard work, and you're going to have setbacks. But the people that are, I love the name of the podcast, the community connected part of that. The people who really care about their communities, they forge ahead despite the setbacks. And that's what we've done is made that happen. And now we're seeing, right? We were talking a little before we went on air, like there's fundamental new challenges in public sector entities, private sector. We have AI coming. We have a generational shift. 75% of the workforce are now millennial and Gen Z. We have health plans that were optimized and built when the greatest generation and boomers were the workforce, and it was mainly acute care. Now it's chronic health, chronic conditions, mental health. So we have all these convergent factors and some regulatory shifts. So that's why we have a new day, and that's why you needed, obviously, to have a new supply chain that meets the moment.
Wow. That's a lot, but great. And yeah, it is a social movement. And that's what I feel like that I'm on, and Colton will agree that we're out here pushing this. And I think you said at the beginning of the conversation as well that, the system's pushing back, and you can decide who that is. And I think in a previous podcast, I said, we feel like pioneers. We're out here, Lewis and Clark, and we're going through the river. And next thing you know, our donkeys are floating down the river because we thought we were in an area where there was no rapids. And then the bears are chasing us. And then, the hostiles are in the woods, and it's, you've got the enemy within, and you've got, people out there, especially in the brokerage community, that are just a little long on the tooth. I'll just speak my own language here, maybe a little bit more chronologically challenged than the average millennial. But those are great points. And I think the social movement, and I think that you have the planets are aligning in our universe. We live in a place called Iowa. I'm sure you've heard of it.
Yeah.
We often get accused of growing potatoes here, but we're more of the corn state. But
I used to live in Idaho, and they always say you're in Iowa. But, I know it starts with an I, and there's a lot of vowels, but it is actually a different state.
Yeah, I went to an Arizona-Iowa game back in 1982, and they were throwing potatoes at us, and I'm like, guys,
oh gosh,
wrong vegetable. So that's all right. I forgave them, but. Yeah. So that's incredibly important. And I'm going to have to figure out how to get a mason jar full of that answer so I can go out and give that back to the people that I talk to on a daily basis. But my point about Iowa is we've been really slow to adopt here. And we've been through thick and thin, and we've got a group that won the Rosie Award last year, DMOS, Des Moines Orthopedic Surgeons. And so the CEO, Rich Green, he'll be a featured guest in the future, but he's all in, and he's been working with the Orthopedic Value Network and several other platforms to go out there with his bundles, and which is kind of in the Keith Smith way of doing things, which, that's all part of the Kempton group out in Oklahoma. But he's been instrumental in Iowa, and we're definitely shaking the ground a little bit in what's happening, and we're having other providers that are looking at this going, how are they doing this? And so I won't get off the beaten path too much, but Iowa's been a little bit slower to adopt, but we're finally starting to see the principles of Health Rosetta take shape and really get grounded here. And we're really excited about it, but we're seeing not just the brokers are interested in kicking the tires, but we're also seeing employers that are starting to ask questions more and more about this because they're starting to hear about DPC being a big one for us in the state of Iowa, when we had nobody virtually 3 years ago, and now there's probably 25 clinics that are popping up.
Yeah. Well, I mean, even in my own community, Washington State is where I live, and DPC was literally invented here in Seattle. And it was only in the last 2 years that there was an actual DPC practice in my own area. And so that's the nature of the beast. Things roll out in different phases. I will say, there's some of your Midwest brethren, like in Ohio and Indiana, those states are really lighting up.
Yep.
In terms of a ton of employers doing it. So it's just a matter of time. And it's really valuable to have organizations like DMOS where, the most people would be able to respond to the question, would you like a plan your doctor has? It's a really smart doctor, and make it available to their own employees. That's a powerful story. And that's one that and I'll meet with my doc friends hey guys, you're an employer too. I'm glad DMOS got it, right?
Mm-hmm.
You were sitting there complaining about these big carriers, and that's what you're offering your employees. Isn't there a disconnect? Yeah, matter of fact, there is. And so now some of them have been led to believe they're not big enough to offer that to their employees, which of course is wrong. So that's been an exciting development to see providers as employers themselves, and hats off to the DMOS folks.
Yeah, I just feel like our conversation with employers is just changing. In our previous life, we would have, here's your renewal. We can raise your deductible. We can move to an HMO. You can ask your employees to pay more. You can pay more, or you can do a combination of all these things. And those are not sustainable solutions. And so now the solutions that we're having with our clients or prospective clients is, here's a direct primary care doctor coming to a meeting with us and talking about true healthcare. We're not talking about more insurance. You don't need to buy more insurance or jump from this carrier to the other carrier. It's bringing people that work in healthcare to the conversation that I think is really going to solve this thing. And that's, hence the community connected health. It's, in any given community, there are businesses, there are people, there is usually healthcare, whether it's a hospital or, primary care and so on and so forth. So when you talk to some of these groups, they all hate insurance because of how expensive it's gotten. Usually second or third, largest expense. You talk to the people that work in healthcare, they hate insurance. So it's well, hey guys, how about this? We all sit at the same table and we figure this thing out by removing the insurance aspect of it, and create as many direct pay relationships as possible. And, there's, to your point, through the work that you've done in identifying various TPAs and PBMs and, other organizations that, we're bringing into this blueprint or custom building health plans. There are some that will operate in a fiduciary manner, and some that are just in it for the profits, and we need to be able to sniff those people out. Because it's even, I was just at a conference, and there's always a story, I feel like, with some of the new vendors that are coming into the space, of someone, similar to you, where you've got a story about a friend that, was diagnosed, and, hearing stories about, someone that was on a life-saving medication that was $60,000 a year, and they created a solution to make it more affordable for, other people that are in those situations. And so those are the organizations that we want to try and, latch on to, that are in it for the right reasons, no different than, what Mike Keeban came out and said, why he is getting into it.
Yeah. Yeah.
So it's getting, to kind of backtrack on what you were saying, it's just getting to the point where, the everyday American can't look away of how much we're spending on healthcare. What is it, 4.5 trillion?
I'm sorry, it's actually up to 5.3.
5.3. Okay, it just keeps rising. And like I said,
people are spending more on healthcare than their mortgage or their car.
Yeah.
Or food. Right? It's bonkers.
Yeah. So there's a lot of forces, up against us, but, from your perspective, between the healthcare side and the insurance side of things, what's the biggest problem that you're seeing, that especially employers face?
Yeah. I might sum it up as value extracting middlemen. The actual, there's two parts that really are very valid parts of the payment. There's a couple more, but like the big buckets, like actually the insurance part of health insurance that was surprising to me is even the big carriers, they will buy stop loss insurance for these shock claims, right? Mm-hmm. The rest of healthcare, that's a small number of claims that are the equivalent of your house burning down or a bad car accident or something, not the equivalent of, getting an oil change or replacing your fridge, which, you wouldn't send that through your homeowner's insurance for that. And that's typically maybe 20 cents of the premium is this kind of the real insurance, whether you're at a carrier, a carrier that buys from the stop loss carriers, oddly enough. And then the actual care part. The actual care part isn't expensive. Do you know that in the 6 years since I wrote my last book, I did this analysis of using Bureau of Labor Statistics data and doing a 30% bump for benefits, that if you add up all the pay for every clinician, from a medical assistant to a physician and everything in between, it was back then, it was 27 cents, which is super small. Today, it's actually down to 23 cents. So the actual healthcare part isn't expensive. That's budgetable, that's predictable. There's high value organizations to work with there. It's all these middlemen that are making things that are very affordable, not affordable. And I'll give you an extreme example, but there's many examples like this all over the healthcare system. And this is public record, so you can go check this. There's a lawsuit out in California where it was a inpatient psych claim. The billed charges were $996,000. Now, we'll put aside whether all those charges were valid or not. A lot of times there's mistakes, but let's just take it at face value. And it was Cigna was the carrier, and then they work with a company called Multiplan that does supposedly negotiating. And so that just under $1 million claim turned into an $11 million claim, according to Cigna. And then they, quote unquote, saved $7 million and said, okay, employer, you pay $4 million. So the employer paid $4 million. Cigna made $2.5 million. Multiplan made, I think, $670,000. And then the rest actually went to the provider. So that type of thing is happening over and over and over. And there's this concept that if you're a health plan wonk, you hear in the drug supply side of spread pricing, right? This gap between what's actually charged to the employer, which is super high, and what actually goes to the pharmacy. And there's all this profiteering in between there. Now the same thing has happened on medical claims. And so if you're not paying attention and you don't know how to contract right, you don't know how to scrutinize claims right, you don't have access to your claims data, you've just given the healthcare industry an unlimited corporate credit card to, we just had the Super Bowl recently, right? They had the best Super Bowl party ever, right? And, stay in the Fairmont, Four Seasons, whatever it is, order the Dom Perignon, you name it. They can do that on your nickel. And if you wondered where 30 years of wage gains for the working and middle class went, that's where they went. It's a direct line. It's not some 10-point conspiracy theory. The data is incredibly clear. And so what we found, we all know, is that's optional. And once you realize that it's optional and healthcare is actually very affordable, then you're on a different path. And that's the biggest obstacle in all of this, is just that mindset shift.
Well, yeah, it's complex. And as I like to say over and over, we've made up our own language in this business, right? And so people are on the rails, and then it's an emotional transaction, and we're going to do everything we can to save that life. As far as our experience is concerned over the last couple of years, we haven't necessarily seen the impact of, a single large claimant on our plans. We've had a few of those out there, but we've seen massive amounts of aggregate claims across all of our pools. And that seems to be a big challenge, at least, in little old Iowa for us, where we're seeing claim intensity like we've never seen it in the GLP-1 drugs. But you touched on a really valid point as far as just the actual cost of care. My experience driving across the fruited plain of Iowa over the last 31 years have seen a mass consolidation of the healthcare industry. We had small docs in every town. We had independently owned hospitals. And it's just this consolidation and not understanding where all these dollars are going. And that's the question we continually ask. But you're right, there's another path here. And that's the path that we're on, is that we're working on these direct contracts, bundle pricing, and do you see that is still gaining momentum in your side of things? You're seeing explosive growth in that area.
Yeah, and it's and sometimes direct contracts can be kind of a misnomer. It's that because there sometimes are direct contracts with an employer and a provider, but what's happened is there's been an emergent set of new kind of contract aggregators, and rather than doing a 30% markup or literally like a 400% markup, they're just doing a transaction enablement. So it's more like your Visa fee as a retailer or a Stripe fee or something like that. It's a reasonable amount, and it's just an alternative way, and the payment terms are way better for the provider, both in terms of the dollars they get, the timeliness, waiving copays, so they don't have to become basically kind of a bank extending loans to patients, and having to get in the bill collecting business. So we can solve a lot of problems for the hospital. And what I'm very convinced you're seeing right now with what you're talking about, all these turbocharged claims, by far the most active area of AI in healthcare is in this revenue cycle management, which is this fancy term for how do you get as big a bill out and game every reimbursement system there is. And if you don't have the countermeasures for that, that's why these things are going crazy, because they know what claims get checked and what doesn't. It's the same thing that the hackers have been doing for years. So a substantial part of the economy of Eastern Europe are cyber criminals. This is not crazy talk. Just talk to any cyber expert, and they will also tell you the most lucrative area of cybercrime is healthcare. Because it's one thing if credit cards get hacked. Once it gets figured out, they issue new credit cards. You get an insurance card, you get a social security number, like you theoretically have that for life. And so FBI, Accenture published, it was like 10 years ago, they called it a $274 billion swindle, talking about cybercrime. Now the, sort of domestic and maybe a little more less shady, but every aggressive, in fact, a lot more aggressive, are the consultants that are consulting to these hospitals on this revenue cycle. And if you don't have the countermeasures for that, you don't have the right contracts, that's where these dollars are going. It's not going in the pockets of doctors or nurses and medical assistants. It's going into these giant corporate extraction machines.
Yeah, I feel like from an employer perspective, some of them haven't realized that the cards are really stacked against them between the vertical integration that's happening on the insurance side and then the massive consolidation that's happening on the hospital side. So do you maybe want to speak to some of that?
Yeah, I mean, you summed it up really well. And I would just add that, sometimes there's a perception that the big health systems and the big carriers are at odds with each other. And now and there, there'll be a scrap, but they are both very directly incented to have the cost of healthcare going up. You think about an insurance company, particularly if their margin percentage is capped, like what the ACA did. Would they rather insure, $1 billion of spend or $10 billion of spend if they can get 15 or 20% of every dollar, right? The answer is obvious. And the hospitals go along with that. They benefit from the spending going up. And so it's not that the clinicians who we love, right? We love the doctors and nurses who've been called to this sacred profession. But a lot of times they don't know what's going on in their name. And, I see it in my own community. I'm in a community of about 250,000 people as a single hospital town. And the big health system that's here, they're charging just under 4 times Medicare rates. And it's the highest in the state. And if they charge twice Medicare rates, which would still be pretty extreme, then that would be $375 million into the pockets of working people in our community that could go to a much higher and better use than sucking it out of our economy and taking it back to the mothership. And I think that's the real aha that Americans are starting to have. It's much less about a right and left thing. It's much more about sort of kind of feudalism and colonialism on our communities and sovereignty and taking back control. The way I put it is every community has a river of healthcare money flowing through it. And the source of that river of healthcare money is all of our pockets. And it should work like a water cycle and recycle and replenish and restore health in our community. But instead, there's these giant corporate pipelines extracting it to Wall Street and their water carriers and leaving us all in drought. And that's an option that we're de facto accepting until we don't. And that's the game change, is this reclaiming sovereignty, reclaiming that community connection, and everything changes after that.
Yeah. We just spoke to a school district earlier today, and, they almost have $1,000 single premiums, almost $3,000 family premiums. And the cost is going up, 8 or 9%. And so we asked, well, how's your plan performing? And, really couldn't give us any sort of insight into, of that premium that he's paying, what did they pay out in claims? And so I'm also feeling like we're seeing a shift in people asking for that data, because he now put that on his to-do list. And in a world that we live in today, data is everything. And I think employers have traditionally just, wrote the check and then just said that, oh, well, this carrier is going to work on my behalf in a trustworthy manner. But now we're starting to find out, that that's not actually happening. And, the lawsuits are popping up, right and left. And so, data is everything. And, if a business owner sees any other line item increase by 10 or 20%, they're probably going to ask why, or, move to a different vendor or figure something out. But we're just continuing to see, some employers just kind of accept defeat in health insurance and just continuing to sign on those, the dotted line, and maybe they're being told by their broker it is what it is. Of course, we're trying to reach, the employers that are ready to say enough is enough. But yeah, just some comments based off what you were saying.
Yeah, and I'm glad you brought up the river analogy. And I was talking to a city manager today, and I did more of a meatball calculation. I said, you realize you have about 120 million. This is a community of 11,000. Said, yeah, rough estimate, you've got $120 million that's being evacuated out of your city every year. That's going to shiny buildings and faraway places. Yeah. And, we're raising our kids. I live in a small town, and we raise them, and then they're sent off to college, never to return. And, we've seen what's happened in the blight of manufacturing, and it goes on and on. But that was, perfect timing on that. And I think it's also important that, that we're definitely talking big world ideas, but the way Health Rosetta was built and the way the community connected health was built is we've scaled these big ideas like the Tom Emmerichs from Walmart and Caterpillar, who, obviously was an influence on both of our careers, Dave, but we've been able to scale these programs now to much smaller employers. I mean, we're writing these options down for employers even under 50 employees. Because that's the other thing, we get that pushback. It's like, they immediately get nervous that we're going to take their doctor away from them. Like, no, that's not going to happen. We're going to give you some options because everybody remembers zero. And that's kind of where we're going to lead things here. That's where you're going to win. That's the promised land. But I want to make sure I emphasize that as we're discussing, people are tuning in on this podcast, CFO, CEOs, HR specialists, that we've scaled this down. And it's by virtue of the work that Health Rosetta has done. So maybe you can speak to that a little bit, just to build that comfort zone for employers, because you do have a plan grader, and that's something that we've utilized. That's what DMOS did, and they're a little larger employer. But that's a great way to start, because yes, we're data-driven, Colton, and that's a huge part of this one. And we have to have our employers ask for that. And we're getting more questions, and they're bringing up things. So these little drips that we're doing out here with these podcasts and everything else that you're doing, it's starting to show up with questions that we're getting. But I want to make sure we're emphasizing that, Health Rosetta and what you're doing, you're not here to help the blue chip corporations, although you're there to help them, but you're here to help really anybody. We're really kind of small town, community focused, also urban areas too.
Yeah. And we're disappointed that we are now limited to companies 5 and more. Like, we want to get below 5 employees. Yeah. But that's pretty small. Yeah. And that's when we started offering, like, we want to walk the talk ourselves. Mm-hmm. In fact, the Rosie Award, we have a Walk the Talk award that the DMOS guys won, people in our industry. So of course, we had different options than a Walmart would have, but we can do this. We can have a plan that's built on primary care. We can have affordable medications. We can have great hospital contracts. It actually doesn't have to be that complex. And I want to go back to something you mentioned with the school districts and the CFOs and CEOs, because it just fresh in my brain, where I was talking to the head of the employer healthcare cooperative of Wisconsin. And he had been the CFO of a school district in Wisconsin. And he, for a while, went along with the so-called solution as just put more on the backs of the people least able to afford it. Mm. And he put in one of these plans, and the secretary in the office was like, can't do it, can't afford it. And what happened, sadly, I'm quite certain, is probably the third leading cause of death in America, is people avoiding care. So she avoided care because she didn't have insurance. And even sometimes people have so-called insurance, and the costs are higher, the out-of-pocket costs are higher than their life savings. So they may as well be uninsured. I call them function uninsured. And so she deferred getting a care, ended up getting a cancer that was very treatable. If it had been caught early, it wasn't. She died. And that was a brutal gut punch to him where he's like, I got to do something different. And, it is not a solution when we're putting more onto the backs of the people who least able to afford it. And fortunately, like if you have 5 employees or more, you can do it. There's even some, things you can do smaller than that, but that's pretty small.
Mm-hmm.
Like most employers have 5 employees on their plan. And that's been a big part of, what you were just saying. We've tried to do is take these things that a Tom Emmerich at Walmart could do, make it available to everybody. And that's been a slog, and it's taken us a while to get there, but we are at that point. So it is now your choice as that CEO, CFO of these companies where it's this bizarre disconnect where somebody turns in an expense report and it's missing a $76 restaurant receipt, rejected. And then sight unseen, they'll pay a 6-figure hospital bill.
Yeah.
Like it makes no sense. And unfortunately, I haven't seen a hospital bill go out over $5,000 that didn't have some errors, and some of them are really extreme. And there's some creative solutions people do, like this employer in Massachusetts, and they said the employees, hey, if you find a billing error that we didn't catch, the TPA didn't catch, and we don't end up having to pay for it, we're going to give you, I think it was 20% of that. One of the employees found a $200,000.
That'll make people pay attention.
Yeah, and they did the big Ed McMahon check.
Oh, that's awesome.
She had like a $40,000-$50,000 check.
Yeah.
That she got. Boy, everybody became a bill reviewer at that point, because at the end of the day, not to get political, but I'm like, when you get into this like single payers, like we already have single payer. Like I haven't heard any Australians or Italians saying, "I'll volunteer to pay Americans healthcare."
Yeah.
It's all out of our pocket one way or another.
Yeah.
And it's not the insurance. There's not some magic separate pot of money. It's our money. You pay these outrageous bills without stopping it. It's going to bite you the next year and the year after that and the year after that and the year after that. And so that's, I think, what some of the really smart employers who are working with great advisors like you guys are really thoughtful about how they roll these out, communicate it, design it, and turn people who may initially, kind of cross their arms when they hear this new thing because they've heard for decades, we've got this new program, right?
Mm-hmm.
And they have every reason to be skeptical. But once you actually ladder up trust, like, oh, I got a free primary care visit in the lab and imaging, and they realize this thing is for real, and they start to understand why, that it's affordable, and it's not complicated math. Would an employer rather pay 80% of a $5,000 MRI or 100% of a $500 MRI? And it's that type of thing that's like, once people go, oh yeah, that does make sense. That's why we can have it be zero cost for people.
Well, it's very powerful. And I've had instances where I, was dreaming about the day that I would hear from an employee and be, where they're in tears. They've told me, oh, I didn't have to pay $4,000 for my surgery. I'd saved for 3 years for my vacation for my family, but it was surgery or vacation. And so I'm going to, I don't have to pay that now. I can take this vacation. And they ask me, they're pinching themselves saying, is this correct? And I'm yes, we're seeing those examples in direct primary care, durable medical equipment. We're seeing it on the medications, obviously, and the surgical bundles. And it's gotten quite creative. But speaking of creative, the hospitals, the traditional ones, and the traditional providers are out there that really don't. A lot of them out there I found don't even know about these things. I'm having conversations with rural hospitals and they're like, what are you talking about? What are you, this DPC? I'm like, this is not coming to a theater near you. It's already in the theater.
Yeah.
You're going to start losing patients because people in this new generation, as you said, it's the Generation X and the millennials that are dominating the workforce, and they're fed up. Healthcare was designed during World War II or right after World War II when the GIs all came back and they wanted to provide benefits and they started competing for each other. But now we've seen, the medical debt is just staggering where people are told they're going to have to pay up front before they get their surgeries. There's companies out there where they're actually helping hospitals collect the dollars by amortizing it. You can amortize your Big Mac now. And I don't know if you knew that, Dave. but you can actually make payments on your Big Mac. So it's those types of folks that have gotten creative and like, hey, congratulations on having your new baby. Talk to Jerry, our financial planner here in the office, and he'll get you set up on a payment program. So you've got, one doctor for every doctor, you've got 10 administrators that are chasing the money. It's like walking into a casino. When you walk into a hospital or to a doctor's office, there's bells going off, people running around, their pants on fire and papers flying in the air, and they're just trying to chase their money. And once the doctors realize what's going to happen, that their accounts receivable are going to get in order and the patients are going to get better care, and then hearing the testimonials, that's been the payoff for me. I mean, that's like, oh, finally we've arrived to a point where we are making a difference. And the employees, they like to talk to each other, believe it or not, at the water cooler or wherever they're at. And they start telling each other, hey, did you try this as an option? That's where it's going to grow. And it's going to explode across this country, I'm convinced.
Yeah, Dave, I think it was you that talks about, how disruptive health plans can be. And it's like, well, there's disruptive A and there's disruptive B. There's what you just alluded to, that story you told about that gentleman in Wisconsin. Well, if we raise deductibles, or just keep deductibles the same and we raise premiums, it's just all this scaling back of benefits, or wage stagnation that's happening. And then people are avoiding care because they're functionally uninsured. And I had a conversation with a nonprofit organization that had a $9,100 deductible. And if you ask them what their average wage earner was, I mean, you'd see a massive discrepancy in their earnings to, the benefits. And so, yeah, perfect example of being functionally uninsured. And so for the folks that don't want to look outside the box because of the potential disruption, it's like, well, what you're already doing today is likely disruptive to your people because they can't afford their copays, they can't afford their deductibles, they can't afford, this and that. And so what do you have to lose to, adopting some of these strategies and really getting in tune with, these Health Rosetta principles and self-funding and direct contracts and DPC and, finding a good PBM, so on and so forth. Because, from the employer's perspective, I think they want easy. From the consumer perspective, they want easy. I just want to go to the doctor and I want to show my card. But yet we spend, 10, 20, 30 minutes on Amazon, searching for our next, calendar for 2026, or our next water bottle or whatever, or going to the car dealership to search for our next vehicle. So, I mean, this is, full facet. We need employers that are more engaged on the purchasing side, but we also need, from the, employee side, more employee buy-in, and embracing, being a good consumer.
That's the key is, when you're spending a lot in the healthcare system from a health plan perspective, that's probably the worst moment in your life. And so you need these proxy shoppers. That's what you guys help employers do and the employers. If I sum up what's a great plan, it makes great decisions free, bad decisions expensive. And you don't have to, turn somebody who's fighting cancer into, the consumer, reporter on the local TV station, right? Like, we don't need to make it that complicated for folks. And that's the beauty of these plans is you can make it really easy for them. And, I'm a real believer in not only direct primary care, but the care navigation with unconflicted people. Because frankly, when you have a serious medical issue, which I've seen with friends with cancer, my dad's Parkinson's, this is like climbing Everest.
Yeah.
You wouldn't climb Everest without a Sherpa. You'd die. Mm-hmm. And frankly, it's more dangerous to enter the healthcare system without going to the right place. Preventable medical mistakes are the third leading cause of death in America. The opioid crisis, that's a function of our healthcare system and status quo plans, right? We paid for things that there's no medical evidence for. And then we didn't pay for things that there's really strong evidence for like standard lower back pain, the number one driver of opioid prescriptions. We wouldn't pay for PT. We'd put big deductibles, even though that's what is by far the most effective thing. And then we would pay sight unseen for these drugs that would get you addicted if you're on them for, a week. And all they're doing is short-term masking of pain while the underlying cause was there. And so that's the type of thing that's disruptive, right? That's disruptive. And 100 million Americans in debt to healthcare, that's disruptive, right? We're the global leader in medical bill driven bankruptcy because of our status quo plans. That's disruptive. This stuff is just restoring sanity. And so, yeah, it's different. We got to be thoughtful in how we roll it out. But that's why I always push back when sometimes people will call me a disruptor. I mean, no, I'm a restorer. This is just restoring sanity. And we can do that. And it's our choice. And let's get on with it.
Yep. Well, maybe we can spend the last 5 or so minutes switching the sentiment to, positive things that are happening. And maybe if you want to share, 2 or 3, things that pop into your mind of just really encouraging things that are happening that employers are doing. I know you mentioned that employer in Massachusetts. Can you share some other examples of some employers that are really just, changing the game, not only for their organization, their community, and their people?
I'm gonna add a little sauce to that too, and maybe what they've done and what their success is, and reinvesting back into their communities or their employees. So, just a little caveat.
There's a manufacturer in Alabama, the only U.S. based manufacturer of wire mesh. Like those lounge chairs you have outside, or the screens, that type of stuff. They didn't accept what too many manufacturers did. I mean, a lot of the reason things moved offshore is because of healthcare costs. If you go back and look at what was driving it, it was healthcare costs were an unpredictable thing. And so rather than solve the root cause, they're just like, we'll just ship the jobs outside. Well, they didn't accept it. Pfeiffer Inc. is the company. And you mentioned the plan grader. Like, as employers go, they were very on top of it. They would apply their Lean Six Sigma and Kaizen events and all that stuff. And the Russell Dubose, who's the head of HR, was at an event and heard about my book. Somebody gave it to him, and he's like, "Wow, this is great. We should do some of this stuff." And got the plan grader, and he thought he was like, they had just amazing plan, their current plan. And again, most status quo plans, when they go through a plan grader, get between a 5 and a 17 out of 100. And it's not like we're, scoring on some impossible thing. There are not a lot of employers, but there's ones that have 80, 90, and so on. And they got a 37, which is pretty good. But he's like, oh my God, I thought we were the best. And he just looked at that as a punch list, started boom, 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 going through it. And, Alabama's not the easiest place. Very consolidated market. We were talking about both on the provider and carrier side, invested in primary care. And they just went through that like a punch list, of projects. And they're now, I think, in the 6th year of flat or declining costs. Primary care has gotten better, the direct contracts. And then the best thing, which you're alluding to, is what have they done? They've added benefit after benefit after benefit. They're removing cost sharing. They've funded college scholarships for employees' kids. They have summer enrichment programs, during the summer vacation. And every year they have a new item that they add based on the feedback they talk to employees. What do you want? What can we do? And it becomes this shared journey. Like, oh my God, we do these things, it's going to put more money in our pockets or help my kids get their college paid for. It just gets this virtuous cycle going. And there's a bunch of stories like that, large and small. And that's certainly what keeps me going. It's the convenience store worker who, like what you're talking about, had this expensive medication, life-saving. She was making $12 an hour. And ever since she'd been married and had kids, never been able to take a vacation. All of a sudden, she's paying $0. so finally was able to take her kids and her husband on a vacation because she effectively got a $3,000 raise per year because she didn't have this out-of-pocket cost. And it was just, she was in tears with the CEO of that company. It was really cool to hear about. So those types of stories are all over now. And that's certainly what keeps me going, because you guys know it's tough work. We get kicked in the teeth every day. We scrape our knees. Like I said earlier, all great things are tough, and all great things have setbacks. But the reward is immense once you do it.
Well said.
Yeah, couldn't agree with you more. And I mean, you probably you don't have to agree on this, but there's a lot of folks out there on our side of the world that are also acting as barriers for employers, and kind of the big bad wolf thing. And let's also face it, the retail carrier market hasn't done a good job at, once employers have taken that bold move of making a change, they didn't have such a good experience. So that's an obstacle too that we seem to get. And I call it emotional terrorism. People they think that their insurance card's their doctor. Yes, but it's so easy. And it is. And it is, speaking of not easy, our business is not easy, but these are things that are all worth doing. And I think it's going to get progressively easier, especially as we get into a market in Iowa where, it's kind of a new thing, and people are very conservative in the state, and they're, very apprehensive, and they're not usually fans of insurance salesmen to begin with. But once they realize that we're actually bringing the doctors to the table, that's a different kind of conversation. We've never had that opportunity. And that's been, I think, one of the most rewarding things is when we actually have the doctors sitting there and talking with us about, in their vernacular, about what they're doing for their patient care. Because all they want to do is take care of their patients. I mean, that's really, truly what it's about. So
yeah, and there's definitely a smart way of doing this where I think the two best ways I've seen is, like the Pfeiffer example, we're like, okay, we're here, we want to get here. Yeah. We're going to do it a step at a time. We're going to tackle primary care, tackle PBM, or tackle direct contracts, build that momentum. Another approach folks take is they leave the old plan in place. Mm-hmm. You create this new one that's very appealing and say, you can still deal with that old world where you have $9,000 deductibles and you get EOBs and all these things that are just designed to defeat you. Or you can go over here where good decisions are free. And you're not forcing anybody, but you make that very appealing. That's what we see work really well is, one or two of those options. There's a few who will do the rip the Band-Aid off and just go cold turkey into the new world. Maybe 10% will do that. And if they got really high trust or they're really in a desperate situation, that's their prerogative. But we think either of those two other approaches are very doable and not disruptive to their workforce when it's designed well.
So I think to sum up our discussion here is employers don't need to accept defeat. There are options that are available. It's part of that is getting access to your data. Educating yourself or finding someone that can educate you on these alternative solutions. And, it can be very rewarding, not only for your business, but for the people that, work for you.
Yeah. And I think there's a mindset we're really here for the greater good. And I know that sounds a little bit hokey, but the things that we're doing, we're opening doorways for other people in our industry. Once we get a direct contract or we have a DPC, there are other people that are brokers that'll have access to these things. We don't have time to write every single piece of business. We're not out here to do that.
Mm-hmm. Just push the mission forward.
Just push the mission forward. So Dave, one last thing. Again, thank you so much for your time. It's just so great to talk to you. You're such an eloquent, you're a gentleman. You're an eloquent gentleman. Love everything that you guys are doing and looking forward to, just as this thing evolves, just a bright future. But you have an annual conference coming up. And if people hearing this broadcast want to reach out, learn more about Health Rosetta, maybe talk about when you're doing your annual conference, because we're going to be out there seeing you in Nashville.
Yeah.
So looking forward to that. But if you want to give us maybe some dates and maybe ways that we can reach out to you, and some employers have contacted you directly as well, because they're looking for a Health Rosetta advisor in their area.
Yeah, for sure. RosettaFest.org. They can get all the details there. And I mentioned your Midwestern brethren in Ohio.
Mm-hmm.
And Christina King's one of your counterparts, brought a number of employers.
Mm-hmm.
They got such a positive response. They're renting one of those big coach buses, that are kind of Lux, and they're driving down. So we're gonna have a lot of employers this year, which is exciting.
Party bus. We got to get a party bus.
Yeah, totally party bus.
I'm loving this idea.
That
Okay.
bus, that's
All
so
right.
fun.
All right.
And so maybe they'll do a swing by Iowa. But can you give me time for one more story that just hit me?
Yeah.
Absolutely. Please.
So one of the first HR people that I talked to and had this case study in the first book was a HR leader at a manufacturer in Oklahoma, and did the things we said. And there's a couple things that, and great for their business and save money, all that. But there's two things that stick out about that story. One was he shared the story where he was at a high school football game in the fall, and it was kind of late fall, and he's sitting there, and all of a sudden this like family comes over to him. It was one of the employees, and the gentleman, he had needed some kind of surgery, like we were talking about. They were trying to decide in their case between was it going to be Christmas or surgery, and they got basically the highest quality facility surgeon. Spent zero, came around him, just gave him this big hug, and he's like, "This is nice, but why do you give me this hug?" You're like, "We're gonna have Christmas this year. There's gonna be presents under the tree because of what you did." And so that was a very heartwarming moment. And then that HR director, he ended up becoming the CEO of that company because it had that kind of impact on the company. Yeah. So that's, you don't see that many HR leaders becoming CEOs of companies, but that's the type of thing that can happen. You can have that immense human impact, and it was great for him professionally, great for the company's bottom line too. So it was really a triple win there. So that's what's possible when you step into this.
Yeah.
Yep. And we're probably going to hear a lot more of those stories at Rosetta Fest.
Yep, absolutely. We have these awards for the best health plans in America.
Yeah.
And it's gotten more and more competitive. And we're doing kind of a March Madness thing as some of the early nominations are coming in. So looking forward to seeing those. It's certainly fun to see the impact that's rippling throughout the country. And really appreciate you giving me some airtime on your show.
Oh, that's an honor. And, you've had good problems. We went to DC a couple of years ago. What a blowout that was. And I mean, you were at capacity, as you know, and I think we had to give shoulder rides around there to walk around that joint. And then of course, Denver was a big venue, and the fact that it was really celebrating DPC out there. So looking forward to seeing you in Nashville. You take care, and you can go ahead and get those dogs fed now, because we're about a minute away from them barking.
I know. So. Yeah, exactly. Well, thanks again for having me on, guys.
Thanks, Dave.
Dave, thank you, sir. Be well.